Welcome back to episode 2 of the management of the diabetic foot in the Sculpting the Foot series. We just had a vibrant conversation with Dr. Patricia Nowell, or a podiatrist with over 25, 30 years of experience in her field of medicine. And I'm Dr. Blake McCain, a medical doctor and a public health specialist. I'm from the island of Jamaica, and Dr. Nowell is from the United States. She practices there, and she also is of Caribbean heritage. She's from Guyana as well. So, our segment 2, we're going to go into the treatment, the management of the diabetic foot. We're going to talk about the poor circulation that happens in the patient who has a diabetic foot or who has diabetes. We're going to talk about some of the treatment modalities that we use for such patients. We're going to talk about the complications of poor circulation, such as diabetic ulcers. That's a complication. We also are going to talk about diabetic neuropathy, which is a complication of having diabetes because it's a progressive disease, and diabetic neuropathy describes a nerve problem in the foot. So it's a pathology that affects the nerves. So you end up with paresthesia. That's what we call numbness of the foot, a tingling in the foot, or you're unable to feel the toes or the foot at all. So you step on pebbles, or you may have a pebble in your shoe. And when you put on your shoe, the pebble presses into a particular spot on your foot. And over time, that pebble erodes into the soft tissue of your foot. And it causes a cut, a wound, which then develops into a nasty sore, which is what then gets bigger and bigger and bigger and bigger, and it just does not heal. And it then becomes what we call an ulcer, and you'd have to come into the doctor. You come into us for care. And so we're beginning with the root cause of all of this, which is poor circulation. And at another point, we'll talk about the control of the sugar itself, which is a key thing, controlling that glycemia, that high sugar in the blood, that will help you to have better control of your diabetes. But that's a totally separate topic that we'll talk about at another time. We'll mention it. We're just talking about the foot now and foot care and the things we need to do. And then we'll talk about diabetes proper and how to help with controlling that blood sugar and how we need to control the inflammation that occurs as a result of an increase in your blood sugar over a period of time. Diabetes mellitus is described as a problem of the endocrine gland, where the pancreas is unable to either produce insulin, or B, produce insulin in a quantity that is sufficient for your body to take that glucose from within the blood and put it inside of the cell. So it stays in the blood, and so you end up with high sugar. You're kind of sweet. So when you pee, for those who pee on the ground sometimes on the outside, you don't want to use the bathroom for some reason, you're out camping maybe. And then when you pee, you then have ants following your pee. That's how you know you're sweet. Or for the men who probably use the toilet and then spray a little all over the place, when you sprinkle, it happens, we know. And so you have some ants starting to follow that. You start to wonder, oh my gosh, am I truly sweet? So are you having a problem with your sugar levels? And that's just not the only way to determine if you have high blood sugar. There are many other ways, and that's why you come to the doctor for your preventative checkups once a year, where you have your checks done and screening for diabetes and screening for other diseases. And that is something that persons like myself, as a physician, a family practitioner, we do these kinds of things for you. We do not wait until the ship has popped and has started to leak before we do something about it. We act before it happens by taking care of our bodies. Self-love and self-care is love for self. And when you love yourself, you can then love others even more. You're not being selfish, but it's important. But if you take care of yourself, you're better able to take care of your family. And if you do not have feet to walk upon, and if you have ulcers on your feet that get bad, and then you get sores, And then you have to lose a toe because you have a diabetic foot. It affects your ability to work and to earn for your family. So welcome back, Dr. Patricia Nowell. Welcome back. We're going to be talking about poor circulation. Come to Dr. Patricia Nowell, who is our podiatrist out of cold New York City. What's the temperatures like there now? Dr. Nowell, can you hear me well? Mic check. Just asking what the temperatures are like in New York City now before we talk about poor circulation.
Hi. Sorry about.
So this is something that happens sometimes.
It's cold. It's brick, as we call it up here. Brick cold.
Brick cold. Okay. It's warm here in the islands.
Yeah,
we call it
very
the Christmas
cold.
breeze, so it's warm. So you see, I'm in my sleeveless.
Of course.
Yeah, so it's warm here. Sun is up as well.
Yeah.
So tell us about the diabetic foot, poor circulation. You mentioned things like this collateral circulation and treatments for this that you offer as a podiatrist or can be offered in the medical system. And tell us about the complications of this poor circulation that can lead to diabetic foot ulcers, the type of treatments we offer in-house, in the office, with dressings, debridement having to be done, hyperbaric oxygen treatment, and so on. So these are some of the things we're looking at to help the individual with the diabetic foot. So I open the floor to you.
Okay, thank you, Dr. Blake McCain. So the last time we talked about poor circulation in the diabetic and how it affects the feet and how it can eventually lead to amputation. And so today, well, we talked about everything that happens in between. The blood sugar, I guess Dr. McCain can explain this better. But the high blood sugar, as she said before, affects the circulation. It affects the arteries, oxygenation. Well, it affects the health of the arteries in your legs and in your feet. The arteries, as you know, are the blood vessels that bring blood to body parts. So as far as the foot is concerned, arteries would be bringing blood to the foot. And what happens in diabetes is that gets compromised. Okay, it starts to, the arteries start to be harder, stiffened, sometimes plaque forms. And so you don't have enough blood flow to the foot. And as a result, it's harder to clear out infections. It's harder to clear out toxins from your toes, from your feet. And patients start to experience cramping when they walk, sometimes worse yet, cramping when they're at rest or when they're sleeping. I remember we used to call that a Charlie horse. I don't know if that term is familiar. Patients get that terrible Charlie horse at the back of their calf. Some patients get cold feet. Some patients get burning. Yes, and overall just pain from this poor arterial circulation that diabetics are more prone to, because other people can get poor arterial circulation. It just happens to be one of the complications of diabetes. So one of the simplest things that we can do to, if you're diabetic, walking. Walking is like the best exercise, the best medicine for this. What it does, it helps to keep your circulation going, your natural circulation going. But what it also does, it opens up collateral circulation. It opens up circulation that is lying quietly in our body, but is there for our use. So when you start walking, this extra circulation starts to open up. And that helps to bring more blood flow to your leg and your foot and your toes. So that's one of
Okay.
the simplest but highly effective ways to help yourself. And other exercise in general, but walking is a great way.
It is
Yeah.
aerobic as
Um,
well.
and
It's
then,
aerobic
we can
exercise.
discuss exactly. There you go.
Mhm.
Yes.
So
Next, we have some supplements that you can take. So, mhm.
right. So you just to pause a bit there. Many persons are now into this movement era because the world has recognized the importance of movement. Movement is important, not just sitting in a chair all day long at your desk, at your computer. That's the job that you do. Or sitting at home in the couch because then you become a couch potato. If you're sitting all night and you know you like to watch TV when you get home from work, move. You can probably get on a stationary cycle while you watch TV, but go very slowly. It's called aerobic exercise. So it's a type of exercise that does not tire you much, and it's the one that causes increased blood flow through the vessels, which is your arteries we're talking about now. That's the vessel that takes blood to the tissue or to the organ and to your toes. We're talking about your toes now. And with that, you get oxygen moving in that blood to that tissue. And oxygen is what's needed by your cells so that certain metabolic processes can take place. And with these good metabolic processes, you're able to make the cell healthy and you can remove with that better circulation blood from the tissue and send it back to the heart via the veins. So just movement alone is very critical. Every day you should move, some kind of movement. And I'm not talking about moving, shuffling from the car to the bar stool or shuffling from the bed to the kitchen. I'm talking about probably climbing your stairs at home 10, 15, 20 times for the day, going up and down in a 20, 30-minute period. I'm talking about just walking, up the road, down the road, walking a block. But Doc, you mentioned poor circulation and the effect of poor circulation because there are some persons who are diabetic and do have this poor circulation. So they have, and if it's in the arteries, it is called arterial insufficiency. So that's poor circulation in the arteries. And if it's in the vein, it's called venous insufficiency. So those are two classifications. And in the diabetic, you definitely will have poor circulation in your arteries if your diabetes is uncontrolled for many years. And it's not just controlling the sugar, it's many, many other factors, including your cholesterol levels and your levels of inflammation and so on. So movement alone helps to open up those tributaries. Dr. Nowell spoke about it. The collateral circulation is those tributaries. Just imagine a river, and in Jamaica, we have the Rio Cobre. That's the Rio Cobre, a big river that we have in this country, or the Rio Grande, for example. And the name is actually in Spanish, by the way, just as I've said it. Big river, Copper River. And you have flow going down that river. Water is flowing down that pathway, that gorge. That, imagine the walls of the riverbank is your artery. So water is flowing through it. Imagine that water being blood. When you walk, the flow is better because then you open up tributaries. So imagine that river having a little stream going off to the side. And so that's a new form of flow. And that flow takes blood to other tissues in the body. And that is why just simply moving is a good thing. Now, some persons can't move as much because when they walk a block, they have pain in the calf. And that is called claudication. That's the big word we use, claudication. They say, boy, doc, I find that when I walk down the road, I have pain in my calf. I just have pain in my foot. Can't make it. So they can't walk a block, or they probably can't walk 2 blocks. And that is a bad sign. And that's a sign of poor circulation, and you should get checked. We see you for that kind of thing. and you go to your doctor. You can come to me if you choose to, if you're in my area, and then we take a look at you. There are lots of studies and tests that we need to do. So Dr. Nowell, or podiatrist with us today, will mention some of the drugs and supplements. I use the word supplements that in her practice they use to help patients with this poor circulation. Doc, anything to say on that issue? All right. So, Dr. Nowell, anything to say on the use of certain drugs that you use in your practice for poor circulation? All right. So,
Okay.
until
So, thanks for explaining.
I'm hearing you quite well. Are you hearing me?
I can switch now.
Okay, great. All right. So what we're going to do, we're going to take a pause for a second with Dr. Nowell and allow her to have a change of devices so that we can continue our discussion. During that time, I will talk a little bit about, during the time that Dr. Nowell is going to switch over to her device, I will talk a little bit about the issue of poor circulation in the diabetics and arterial insufficiency. So I mentioned claudication just now, which does happen or can happen when the blood flow to the limb becomes very poor. So imagine that river, and the river becomes blocked with silt, and so you can't get as much flow down the riverbank. It's the same kind of concept. So you're not getting oxygen and a blood supply to your tissues. And that's the issue. Lack of flow to the tissues. That's the issue. And what happens is, with lack of blood flow to the tissue, which causes an issue, you have low oxygen. And with low oxygen, your cells cry out in pain because they're now in anaerobic respiration. That means you're going through the process of metabolism, because those cells are going to do what it needs to do to live, but it's going to do it without oxygen. And when they do it without oxygen, you have a buildup of a substance called lactic acid, and that is what causes the pain in the muscles. And when persons walk for a bit and then have pain when they get to a block or two, so they have pain in the calf. And this happens for persons who have poor circulation. Different from the person who is not well conditioned and is totally unfit. Totally different story. We're talking about someone who has no issues with moving at all, but it's just that whenever they start walking and walking a block or two, they end up with this pain in the muscles. And over time, when they have this pain, the pain just gets worse. Some will seek medical care, which we're going to talk about with Dr. Nowell shortly, and the drugs that we use. And what tends to happen is, the first thing that happens is that the skin on the foot starts to change because the blood flow is less. So imagine you have sunshine, it's a bright sunny day, and when the plants get the sunshine, they open up, their flowers open up, they bloom, they turn their head towards the sun. When the oxygen to the blood, to the tissues are less, it's like you're not getting enough sunshine, which comes in the form of this oxygen. And so the tissue on the skin starts to change color. It's no longer as radiant as it used to be. It starts to look dull. The texture of the skin changes. It sometimes gets very thin. The color of the skin changes. It gets very dark. It could become a little red. And the next thing that happens, it becomes blackened in some cases. And then this presents itself at the ankle in many persons, right where the arteries pass by right at the ankle, it happens. And they develop ulcers, and they develop sores, ulcers, depressions, the breaking away of the skin right at the level of the ankle joint. That little bone that juts out is called the malleolus. In skinny people, you see it a lot, and it just juts right out. It's just right there, and that area becomes eroded, and that's an ulcer that actually develops. And that happens with persons who have poor circulation. So that's one kind of ulcer that happens from poor circulation, which can happen in a person who has diabetes. So diabetic patients can have poor circulation as well. You can also have another set of patients who do not have diabetes but have poor circulation. But today we're talking about the diabetic patient with poor circulation. So there's more. Then you have the patient who does have this poor circulation to the foot itself. And then when they are exposed to some sort of a trauma, which would not necessarily be trauma in all cases for other persons, a pebble, something as tiny as the size of a 4 or 5 pinheads, just needles away at the sole of the foot, usually at the metatarsal joint, so the ball of the foot, right beneath the big toe. It's as if, man, that pebble just loves that big toe, right between the bottom of the big toe and the other digit, right there. Smack right there, that's where the ulcers tend to develop. Or sometimes in the arch of the foot, the ulcers actually do develop at that spot. We'll have pictures with those at some point for you. And then the skin just erodes and it eats away and just gets bigger and bigger and bigger and bigger. The thing about it is that these sites are not beautiful to look at. And so if we should show those pictures, we'll have to warn our viewers that it can be a little graphic. It helps for you to see what the outcome can be if you go that path. And so it's very, very important for persons to have good control of their blood sugar in the first instance, to then prevent down the road the issue of poor circulation in the second instance, which would then prevent the formation of an ulcer in the third instance, and then which would prevent you having to go to the doctor when you have the ulcer to have it cut out. We call that debrided, cleaning up of the flesh, having special dressings. And it's an ongoing process where you have to go every single week or every 3 days to have this done. And the problem is that it's costly to the patient. And so that's why we're having this kind of conversation, so that persons can practice preventative care and prevent themselves in the first instance from becoming diabetic. And if you're a diabetic, try to control the diabetes. And we haven't yet spoken about the foods to eat and so on, but take your medications if you are on it. So I am going to break for a bit so that we can welcome back Dr. Nowell to talk about the treatment modalities that she uses in her practice with persons who have diabetic ulcers of the feet, and how the debridements are done and the special dressings and the type of therapies and treatments that we have available to such persons. Now, the warning I will definitely give here is this one. It's particularly to our locals. If you get stuck by anything, it matters not what, a nail, a pebble, a leaf, something, and you look at the bottom of your feet and it's not looking so right, please see your physician with immediate effect. Do not delay. Do not throw kerosene oil in the wound, please. Do not throw kerosene oil in the wound. I've seen that. It does not help. I repeat, do not throw kerosene oil in the wound after you've been stuck by a nail, for example. It does not help. I've seen that, and the outcome was not good. So I'm encouraging persons, if the feet look like something's about to happen with it, it's not doing so well, you have to see a physician for proper care, and they will advise you and counsel you on the different things that you need to do. So welcome back, Dr. Nowell. We're ready for you to talk about the treatment modalities that you use in your practice for patients with poor circulation and diabetic ulcers.
Okay. Let me know if you can hear me, because
I can hear you quite well.
great, great. Okay, so thank you, Dr. Blake McCain, for explaining about the poor circulation, the cramping, and the walking, and all of that. Um, Next, as part of managing this poor circulation uh, in diabetics, one of the things we can do is try some natural supplements, supplementing some of the things that the body makes on its own, but we may be lacking because we have diabetes, because we have altered metabolism. The body is not making these things as they should. Our immune system is down. We can't fight certain things. So some of the things we can add to our diet or supplement is omega-3 fatty acids. We call it in the Caribbean fish oil. Fish oil. Take your fish oil, and that's an excellent supplement that helps with circulation. It reduces inflammation, and it even supports your heart health. So that's the main benefit. The added benefit is for your circulation.
Mm-hmm.
And you can buy it as a supplement if you don't like pills. Increase your intake of fatty fish like salmon, mackerel, and so on. Fatty fishes, yes.
Right.
Supplement is garlic. You can increase that in your diet, in your regular diet. They also have garlic pills. If you're amenable to taking that, if that's better for you, you can try garlic pills, garlic supplements. Again, that helps to reduce blood pressure. It helps to improve blood flow. You can get the fresh garlic, like we said. You can get garlic extract or supplements. Ginkgo biloba helps also. You can get that from certain teas. Or you can take, again, the tablet or capsule form. There's quite a few other things. L-arginine. The next one is something that we use a lot in the Caribbean, turmeric, or the curcumin from turmeric. That is really helpful. That reduces inflammation to the blood vessels also and supports healthy blood flow. So that's something, these are things that we can do in our everyday diet or as a supplementation that is accessible and affordable to all of us. So, I really wanted to share that with people because we can be proactive. We can empower ourselves to help some of the diabetes.
Dr. Nowell, right. So I like the fact that you mentioned these things, and I'd like to highlight a few things with respect to that. Because I've met patients who believe, though, that taking these things now and then will solve the problem of the diabetes. It does not, because there are other things you need to do. And that is why you must see your physician. And it helps when you see your medical doctor who understands you, understands how you eat, where you live, and your ability to get certain products to put betwixt the teeth. That's what I say, when you eat. And how he or she can help you create that balance with the food you eat, the supplements that you take, and the drugs you may need to have in order to control that diabetes and to help with that poor circulation. It's a process. And so I have found in practice there are persons who have diabetes and believe they should stop their drugs and just go on these things that you're mentioning. It will not work well for you. Do not do it like that. You must be guided by your physician who will help you. Or you can have an integrative approach between your medical doctor and integrate it with your naturopath. And today you have medical doctors and we have physicians who integrate as well this practice of understanding this this pathology of the condition in the body, giving the drug that is needed, but also looking at how someone eats, the nutrition and the supplementation that you need to have to heal the body. Hippocrates said it, make your medicine your food, make your food your medicine. But when our persons are too far gone down the road of bad circulation, really and truly, you're gonna need a drug. And so the supplements that you may use, this turmeric, this garlic, this L-arginine, and the omegas do help. They help. And there are studies that show how they help. And there's a lot of biochemistry behind it as well. I'll talk about L-arginine. L-arginine is an amino acid, and L stands for levo. And that amino acid helps in the formation of nitric oxide. So it's almost like nitrate. Now, there's a drug that we use, the nitrates, we actually use them in the treatment of hypertension and people with heart disease, right? So now we're discovering, and that's fantastic, that the scientific world has now integrated that into clinical medicine, that the supplementation with L-arginine can help your circulation, because what it does, that nitric oxide at the cellular level, so we're talking about that milieu around the cell, and to make it simple, it's almost as if you have a little pond, which is the cell, and right around it where the grass is growing, that's your milieu. The nitric oxide that is released by the L-arginine will help in the dilation of those vessels. When your vessel dilation means the vessels get fatter. When the vessels get fatter, it means the waterway is broader. If the waterway is broader, it means that the blood flow will be better, meaning that the blood that flows through that bloodway, the waterway, will be better. And that is what improves the circulation. So that is a little of I like to talk about this because a little bit of the physiopathology of how these supplements work. But until you have read the articles on it, it's not just something that people do willy-nilly. There is a science behind it. The issue that I have, Dr. Nowell, with a lot of our patients is that they believe, they hear, oh, it can work, and they take it whenever they feel like, they're not sure what is happening. They don't come in for their regular checks with the physician. Some persons need to be checked every 3 months, some persons every month, some persons every 6 months, and so on. They don't. And so they sit at home taking these things and they're not knowing, is my blood supply getting better? Are my biochemical markers getting better? Biochemical markers meaning the results of those blood tests. In my country, they call it executive profile. It's just a name for doing basic metabolic panels. That's all it is. In your part of the world, that's what it's called, the basic metabolic panels and so on. So I encourage persons, yes, these supplements do help. And the omegas, when you spoke about the omegas from the fatty fish, these small fish are the better one to have, as Dr. Nowell mentioned, because they eat plankton. The plankton are the plant-based material that you find in the sea. And that contains the omegas, the good omegas. So if the fish eats, we live in an ecosystem. And you see, I'm a scientist at heart, you see. And we live in an ecosystem. We live with the trees, we live with the animals, we live with the plants. And once we are in equilibrium with these organisms, we can live a happier life. So when you understand that the sardines eat the plankton, then the mackerel is bigger than the sardine, then the salmon is bigger than the mackerel, or the salmon is bigger than the sardine. The big fish eat the smaller fish. So there's a greater accumulation of this omega in these fish. And so if you eat this, you will get that omega that you need. The omega-3 is anti-inflammatory. The omega-6 is pro-inflammatory. But there has to be a balance between the two of them. Omega-3 and 6. You kind of need both. You can't have too much of one thing good for nothing. That's how we say it in our country. Too much of one thing is good for nothing. In other words, too much of one thing may not benefit you as much as if you had a balance in life, and life is about balance. The sun shines, the rain falls. The moon comes up, the stars are out. It's the same thing. And that is the human body needs to exist in its ecosystem. So, Dr. Nowell, thank you for mentioning the supplements. I really appreciate that because it is important. And there are studies that are done on turmeric as well. I've read those studies, and its anti-inflammatory properties and also its effect on the diabetic foot and diabetic paresthesia, meaning that numbness that they have in the foot. There are studies that have been done on the effects of turmeric, but the thing about it is when you take that turmeric in, are you absorbing it? So we'll leave that for another session because you have to take that turmeric with piperidine or a lipid meaning some kind of fat. So it's actually absorbed into your bloodstream to then get close to the cell, which is that milieu, that pond, so you can then provide what you need for the body. So this is something that I do, something I look at as well. So I'm glad Dr. Nowell has mentioned it. It's one of the areas I like because you have to balance drug therapy with nutrition and balance drug therapy with daily life and how people exist to create that equilibrium. Because in truth and in fact, if you look at the definition of health, and the World Health Organization has defined health as a state of well-being, isn't it? And now we've added health and wellness. So we've added, I call it semantics, but we've added the term health and wellness. For example, in Jamaica, we have the Ministry of Health and Wellness. But for me, health is a state of well-being.
Yeah.
Is your body in equilibrium with the ecosystem you're living in? Does it have homeostasis? Is it in balance? So the person with poor circulation is out of balance, and we're trying to put them back into balance, and that takes time because it's a process as you age. So Dr. Nowell, drug therapy for the person with poor circulation, can you tell us a little bit about that?
Sure. I just want to mention, I like that you brought up the fact about these are not cures for diabetes or anything. As we said in the beginning, these are some supplements. We're talking about treatments for poor circulation. And these are some supplements that can help your overall health with your circulation. Let me see, we left off at turmeric. As you know, we can find that in curry. We use a lot of curry in the community. You can get that in your curry. So that's, some simple things. Vitamin C and vitamin C are great antioxidants that protect the blood vessels from damage. Magnesium, hawthorn berry. So these are some natural supplements that you can use. And as Dr. Blake McCain mentioned, they're not right. They're not cures. And as we mentioned in the last video, Dr. Blake McCain, I know we went over this several times. Everything is dependent on your blood sugar levels. You have to manage those blood sugar levels. And that will be done between you and your primary care doctor, whoever that doctor is. Okay, because that doctor can monitor your sugar levels over the past 3 months. So there's no cheating. I know some people go into the doctor. My mom used to do this. Don't eat for the whole day and then go into the doctor so that the blood sugar would be low when she went into the doctor. And so, but the hemoglobin A1C, you can't cheat with that. That shows how well your blood sugar has been controlled over the last 90 days. So, you can't cheat with that. So you have to work closely with your medical doctor for that. I'm sorry. Some difficulty here.
All right.
So the other important thing I wanted to mention, and then I'll talk about some medications, which we'd really like to avoid. But one important thing besides the walking is smoking is a big detriment to the diabetic on the whole, to anyone, but especially triple deadly for a diabetic. That smoking will cut off your circulation, just make your circulation several times worse. So those who are smokers, who are smokers, need to manage that. Work with their doctors on getting some smoking cessation program. You know, there's willpower. Right? People need help. So some people, their doctors can prescribe medications for them, the patches. There are all kinds of different types of treatments they have for to quit smoking. You know, if willpower doesn't do it.
Hmm. Mm-hmm. If
Okay.
willpower doesn't do it, I'll tell you a story as you mentioned that. I, well, this story is close to home, so let me just mention it. So, yeah, this one is close to home. So, as a child, there's a little ashtray that used to be at home. Used to play with it. It was made of glass. Didn't know my dad smoked, because I was a little girl. I was probably 7 at the time. Never once saw him smoking. But one day, decades later, he said to me, I was a smoker. I said, really? He said, yes. And he said he used to be a chain smoker. So as soon as one cigarette was finished, he just used that one to light another one. And it was just back to back to back. So my dad was just, he was the guy of the day. So his friends knew this. And one day he just stopped cold turkey and they asked him, hey, Blake, how come you're not smoking? He's like, oh man, I decided to just stop. But they didn't know the story why he stopped. I found out decades later when he was telling me the story.
Yeah.
He said one night he got home and he was unable to breathe because he had done a bit of chain smoking that day again. And he just could not breathe, couldn't catch his breath. And he said, Lord, I will never take up another cigarette if you let me survive tonight. And he didn't. And I said, whoa. So willpower is very powerful when your life flashes before your eyes. And that is the moral of the story. That's why I told that story.
Yes.
And one of the things I knew he always had some mint in the car. So I realized that his replacement for the cigar was a little mint. So he always had some halls or something like that in the car. And there are those among us who have that willpower, who will do it. I've seen it before with other persons. And there are other offerings that the healthcare system has, like patches and so on. I would not encourage persons to vape at all. It was the fad, and our teenagers are doing it now, and we are now recognizing that it's not such a good thing because it does causes a different kind of disease process, and our youngsters are having it now as well. So there are ways to get around it. That's the important thing. Help is available. You can get that help. For some persons, just exercise alone is good because when you exercise, become an exercise guru, you release serotonin, you release dopamine. These are two hormones of happiness and of joy. And when you got a cigarette, what the cigarette does is just to give that moment of joy. You feel high, you feel happy. So if you can release those two hormones via another mechanism, then do it. And exercise is one of those mechanisms to do so. So that's an option for smokers. Because stress reduction is not as easy as we think it is in our industrialized world, but exercise among friends, it really can help a lot. So yes, Dr. Nowell, back over to you. You were telling us some more about the...
Absolutely. Yes, those were good points that you brought out. Thank you, Dr. Blake McCain. There's so much to talk about. So some of the drugs now for poor circulation, we can start with like statin drugs. Your doctor, and this is your medical doctor, your primary care doctor, might decide to, if you have, not only if you have high cholesterol, but also if you have poor arterial circulation, as determined. There's so many different tests that we can do. We didn't get into that. There's so many different tests that can visualize plaques in your blood vessels, or there are blood tests that can, like the cholesterol levels that can show how high your cholesterol is. There's some indicators or markers that can show, okay, yes, this person has plaques in their blood vessels. So we know internally that you have plaques in your arteries. So statin drugs are drugs that treat high cholesterol and treat these plaques, can help to improve your circulation. So that's one class of drugs. Then you have other drugs that what they do is make the blood more slippery so it can pass through the blood vessel. So that's another type of treatment. Okay, can't do anything to increase the width of my blood vessel, but I can make it easier. The medicine can make it easier for the blood to pass through my vessels and increase my circulation in that way. So there's that. Then there are other medications that treat the pain of the Charlie horse, the cramping. And then there are like physical treatments. There are like arterial pumps that help to circulation to the leg. And so those are some of the medications and devices that can be used. Let's see, did we talk about, yeah, there's topical oxygen. That's something relatively new. Or there's hyperbaric oxygen therapy. They're more, because at the basis of all of these things is the lack of oxygen that's being delivered to your nerve, the lack of oxygen that's being delivered to your blood vessel, or whatever, or to the tissue on the whole. It's the lack of oxygen. So that's why things like we call it hyperbaric oxygen therapy work so well. So they deliver oxygen to that body part at a higher concentration, allowing the circulation to improve, allowing a wound to heal better. And the same thing with the topical oxygen therapy. And then there are those people who may be so far gone, and I call it go into war. So you have peacetime and then you have wartime. The peacetime is the time for the supplements. You stop smoking. You start walking and doing exercises. You control your blood sugar. You get the medications to open up. That's peacetime. But then sometimes you have to go to war, and that's when you get to surgical intervention. I'll just mention the angioplasty. And you can probably talk more about this than me, Dr. Blake McCain. Angioplasty will get directly to the problem. You would have your surgeon, whether it's a vascular surgeon or over here, interventional radiologists also do that procedure. They insert a balloon into the affected blood vessel in your leg. I've seen them do it at ankle level also. And that balloon will open up. It'll kind of like break the plaque that's in your artery and open up the artery so that blood can flow more freely through your leg, to your feet, to your toes, and thereby avoiding, perfusing your leg, getting more blood in, and thereby avoiding the damage, that lack of circulation. So that's the poor circulation part of it. And, there's a certain percentage of people that go on to need these kind of surgical interventions. But, if we can start with controlling our blood sugar, incorporating certain supplements into our life and into our lives, some antioxidants, some vitamins, different things. If medication is needed, we can probably avoid surgery.
Right. And this takes time. You have to start doing these things from early. From the time, it is said that most of our persons, the minute they're diagnosed with diabetes because they had symptoms, they've actually had it for 5 to 10 years before the actual diagnosis. It means that the process has started. So the minute you get that diagnosis from your doctor, you better keep running. You need to run and say, you know what? Let me change what I'm about to do. And I need to fix how I eat. I need to look at my stress levels. It's a whole body approach. I need to look at what I eat, number one, look at my stress levels, how long I'm sleeping for, determine if I have sleep apnea or not. We spoke about that in our very first episode. We mentioned it. Sleep apnea can cause diabetes as well.
Wow.
Because it causes obesity and it can cause a change in your glycemic levels. They're not yet sure about the mechanism of action, but it can happen. So the question is, do you have sleep apnea? What is sleep apnea? You're sleeping and your partner notices that your entire throat, we call it the supersternal loss, just sucks right in like you're taking in a whole bag of wind. And you stop breathing for a while. And sometimes you may live in a townhouse and you hear your next door neighbor snoring, pulling in the whole room. Now that person has sleep apnea. When you look at them, the face is a little different. Sometimes they have a short chin. Sometimes they have a little thing here. The chin, the whole, the floor of the mouth. That's how we describe it. Looks a little different. So these omohyoid muscles. So underneath the chin just has this little sag. My dad calls it dewlap. I mean, I don't know where he got that word from. But all I remember is I used to look at the little lizards out and I say, I wonder if that's what he's talking about. When the lizards yawn, you see the little thing that comes out there, that's it. So persons who have sleep apnea, I'm very descriptive because I want persons to identify their family members who could have it. And so you can intervene. So sleep apnea can cause diabetes as well. It can cause an obesity and you just can't lose weight. You're on the diet, you're on everything, you're on probiotics, you're on this, you're on that, you're on and you just cannot lose weight or you just cannot control the diabetes. You need to take a look. Do you have sleep apnea? Go and get a sleep test done. You need to see your pulmonologist. That's the place to go. For those of the persons who are in Jamaica, we have this available to you. This is one of the services I offer to my patients for them to have to be evaluated for sleep apnea. So I evaluate them first and then we determine what is happening with them during investigations and then they're actually referred to the pulmonologist. So medicine is a multidisciplinary approach. Today I'm talking with a podiatrist, but I just told you about sleep apnea and how it can cause diabetes as well. Mechanism not yet known, but it can happen. So there's just not only one cause of diabetes. There's a genetic aspect. There's a lifestyle cause as well that can trigger diabetes. So, Lord, my mom and dad has it. That's genetic. And then there's a lifestyle as well. And then the lifestyle leads to the obesity. Or with aging, you end up with sleep apnea. Slim people can have it. Fat people can have the sleep apnea where you have a problem with how you sleep. You wake up in the morning and you're still tired. You went to bed, you think you slept, but you're still tired. So this is something for people to look at. We'll have a sleep apnea talk at another point. One of the drugs, Dr. Nowell, that you mentioned that thins the blood out and makes it a little slippery is pentoxifylline. A lot of people know this particular drug. Makes it slippery. It actually decreases the blood viscosity. And that's what she means by making it slippery. So the cells can, they can pass through those narrow arteries to get it, like passing through those tributaries, just squeezing through, just slithering through so it can take the oxygen that is needed to where it needs to get to. And as we talk about the blood cells, can you imagine a person who has sickle cell anemia and has diabetes? Oh, that's a double whammy.
Yes.
We're going to talk about that another time because the person with sickle cell anemia has a sickle cell, has other problems. And, if they have diabetes with it, that's another issue. But to encourage persons that have diabetes, you may think that your family has had it before. It's in your history, yes. It could be the epigenetic cause of the diabetes, meaning you inherit this gene. It's not in your DNA proper. It's sitting beside it because they just, there's a scientist who just won a Nobel Prize on this several years ago about the epigenetic inheritance. Okay. The question is, can you change the trajectory of the generations to come behind you by changing your lifestyle, how you exist in your ecosystem, in your environment, how you eat, how you play, how you talk, how you sleep, what you do, and then change the generations that come after you, your children and your children's children, so they don't get diabetes, though you have this epigenetic or genetic inheritance of the disease. So what I'm trying to say is you don't have to necessarily accept, mom had it, dad had it, so I have it too, okay, fine, whatever. No, never give up. Do not ever think that because mom died at 50, same thing is going to happen to you. It can. And that's why the physicians, it doesn't have to be so. And that's why you have physicians, you have us to talk about this. And that's why we're talking about it now. So thank you, Dr. Nowell. Is there anything else we haven't mentioned or touched upon? Is it the ulcers, the Debrimas, the special dressings? Did we touch on that just a bit before we close?
Yeah, well, we didn't talk about the diabetic neuropathy and some other things. We can save it for another time, or we can...
Because it's a big topic, right?
Yeah, from diabetic neuropathy, that's where the diabetes affects the nerves. And so you start to get nerve issues, whether that's something like, so we have different types of nerves. We have nerves that help us move. We have nerves that help us feel. But then there are nerves that work in the background and perform functions in the body that we're not even aware of. We don't control. Those are autonomic nerves, right? So motor, sensory, autonomic nerves. You helped me with that, Dr. Blake McCain. And so diabetes can affect all of these different classes of nerves. And all of those show up in the foot, autonomic nerves. So for example,
I like what you're saying. All of those show up in the foot. I'm glad we're talking about the foot because everybody forgets the foot. When we talk about the conditions you're talking about, we talk about it as it relates to persons not digesting their food well. So they have diabetes, they have gastroparesis, we call it, because of diabetes. So the digestion is very slow. So diabetes causes that. We have to talk about it in a second on a totally different lesson or topic, just to chat about that. Or their brain gets a little slower. They're not remembering so well. They're not understanding what's happening, or their eyes not getting a little dull so well. And you said, and I loved how you said it, autonomic dysfunction. Sympathy, and that's autonomic, that's parasympathetic and the sympathetic nervous system. Then you talk about the ones that make you move and the ones that make you feel. So that's the sensory nervous system and the motor system. And all of these things that are affected by diabetes shows up in the foot. You're like, hey, foot, what's going on today? I don't feel like walking, says the foot. I don't feel like walking today. I can't feel anything, says the foot. And the brain is saying, foot, what's wrong with you today? I need to see the doctor, says the foot. We're like, okay, foot, I'll take you to the doctor today. So I like the fact that we're talking about foot because it's so important. And particularly for women who like their nice to paint their nails, it's really horrible when people start to lose their toes because the men feel it as well, and they hide it. So they do. I've met them. We're going to talk about we call it the ugly toe. I call it the topic. The next topic we're going to talk about is the ugly toe, right? Which is all these fungi in the toe. That's yeast. Right. I use the word yeast for persons who don't understand fungus, yeast, etc. We'll talk about that. It affects everybody, male and females. Our males don't talk much. They feel sad, and when they start to lose the toe, the next thing that happens is they get depressed. They stop talking. They stop eating. They stop going out, and next thing they're dead. It's sad. And so families lose their breadwinner or they lose the father figure. And that's why we're having this conversation about the foot. And we're talking about the foot, which is the part below the ankle, right? Not recognizing that once that part starts to get affected, it means that below the knee, something might be going on. Because there are those who have lost the section just below the knee. And there are those who have lost the section just above the knee because of diabetes. And it is not a pleasant experience. It happens to a lot of people. I know of a physician who lost his toe because of diabetes. And he died. Perfect surgery. Everything was wonderful. Perfect surgery after losing the toe. But he died because he lost his toe. Nobody wants to lose a part of your body. Everybody wants to pass through this world with everything intact and live with everything intact. Yes. And that's why we're having this conversation today. So, Dr. Nowell, I'll let you say your final part. So we'll close with you today. Tell us.
Okay. Well, So thank you, Dr. Blake McCain. So let's see, we didn't talk about diabetic neuropathy, or we touched on it. We touched on it.
You touched on it a bit.
Yeah. So, that is diabetic neuropathy, there's so many symptoms. Everyone is different. There's so many different symptoms. One person's pain is not the same as the next person. It can be challenging to treat. And so that's why I like your format, where people can be informed for themselves, and can do things for themselves. We talked about stop smoking, smoking cessation, number 2 thing, number 3 thing, walking, exercise, right? And we know what the number 1 thing is because we keep mentioning it in our videos, in your videos, that control of the blood sugar, daily control of your blood sugar. So those are the things that can help to keep diabetic neuropathy, that is, again, the damage to the nerves, that can help to keep diabetic neuropathy down. I don't want to use the word eliminate, but it can help to keep it down. Supplements people can incorporate into their diet. These are natural occurring things that we make in our body. Alpha lipoic acid, very strong, naturally occurring antioxidant made in the body. You can take it in as a supplement. It's excellent for inflammation, for nourishing the nerves, for nerve regeneration. Gamma-linolenic acid, right? That's another one. It has a high concentration of omega-3 fatty acids. You can find that in evening primrose oil. You can find it in barley, spirulina, things that we eat, oats, vitamin B12. Usually that's if you already have the deficiency. But there are some schools of thought that say adding that supplement can help with nerve pain. I'm sorry. And so there's so many naturopathic things that we can do to help ourselves before we go on to these medications and other types of treatment. Next, we have laser therapy. There are laser treatments now that can help to, how would you describe it? Remove toxins from around the nerve, create an environment in the cell where the nerves can flourish. The nerves can operate as they should. And so, yeah, laser treatments do that. There are electrical stimulation treatments that can help the nerves also. It does that by kind of like altering the way we perceive pain in the nerves. So, those are some of the what we call modalities. Those are some of the physical things that can be done to treat diabetic neuropathy. And then next, go on to the medications. Yeah, I don't want to get into that too much because, those the medications that are being used are like the last resort. Remember we talked about peacetime and now wartime. So the wartime is when you go on to the class of drugs, for example, the tricyclic antidepressant drugs. The doctor may prescribe that for you, and you may see, hey, it says antidepressant. Well, he's not prescribing it because because he thinks you have depression. Your doctor, she may be prescribing it because there's another use for that class of drugs. And one of the uses is that it helps with that nerve pain that patients get. It helps alter how the pain is perceived. And those drugs are very effective, but they also have so many side effects. So that's why, I know you do also, Dr. Blake McCain. We like to educate patients on what you can do before you go on these heavy medications.
Prevention, yeah.
Right. So
early.
Like antidepressants, that's one class of drugs. There are other types of drugs that your doctor can prescribe for you. One of the newest things that's all the rage here in America, but has been very popular in the Caribbean, is cannabidiol, right?
Cannabidiol, you said?
Yes, or let's call it what it is, cannabis. right?
CBD, you mean the CBD portion of the cannabis? Yes,
The
yes,
CBD
definitely.
portion. Okay, well, there's the THC portion too, but that's
Oh,
going to be between you and your doctor.
who
So,
is
I mean,
going to? Yeah,
over
yeah.
here, THC is being used now. The get high part of the marijuana. Um, it has been shown to help with neuropathy. Uh,
Yeah.
but also you can try cannabidiol that doesn't have the get high part, the THC
Mhm,
part.
mhm,
Cannabidiol has been shown to help with neuropathy also. You can buy
mhm,
um, supplements like creams and their oils that
mhm.
contain cannabidiol that you can rub on your feet or your legs that do help with neuropathic pain, with nerve.
Pain. Yeah, it
So,
does.
just that's just a glance over some of the
The
treatments that
things.
are available.
Yeah. I mean, the truth of the matter is, I mean, we mentioned it, but we've always known that there are receptor sites in the body, and there are receptor sites for the cannabinoids, the CBD,
That's
you
right.
know. There are
Yeah.
receptor sites in the body and pain receptor sites, and that is what the science is based on, and that is why it has become such a more popular thing to look at now. I mean, in Jamaica, we really, 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 as an island, because we've got the best in the world, so I've heard, we really should do a lot more in the area of science and technology
Yeah.
to do a lot more research into our own strain of the marijuana or cannabis that we have here. But we are a developing country. We know this. It takes money, it takes resources. So I imagine that we will have to get support from outside to actually do the study on what we have here and the effects it actually has on our people here as well.
Yeah.
So often we see what's happening in the rest of the world, but our people here already knew it. They knew it all along. They were always doing it. I mean, even they were running away from the arms of the law. They knew why they were doing it. They're like, man, this thing make me feel good. I'm taking it. I ain't stopping. So that that's them, right? That's what they do. But they always knew it had an effect. And I put it that way because in the world of science, how discoveries were made is by looking at the people and what the people do. It didn't just happen like that. Someone of a scientific mind would look at the population and say, hey, why is he doing that? Why does he look that way? And that's why a scientist is a scientist, a critical thinker. He
Right.
does this and he does that. He takes the CBD and he doesn't, and they both have the same thing. And this one is getting better and this one is not. I wonder if. And so they take this sample of this product and then they go on and study it. That's all it is. So I believe it's something, we should talk about it. We really should explore it. And I'm glad the world is looking at it now. But for my country, I really suggest that I recommend, I encourage that our people or investors, both private and public investors, look at putting a lot more into this kind of research using our scientists from or great universities such as the University of the West Indies, and we have other institutions in our country, and actually look at studying this thing here and publishing the articles in a place that we all can have access to it. Because there are publications, but it's not easy to get access to it because the population does not really know where to. So we just need to talk about it some more and open the floor for it. So, Dr. Nowell, I thank you so much for this or episode 2 of or segment 2 of episode 2 in our Sculpting the Foot series. And our episode 2 was about the management of the diabetic foot. And in summary, we looked at the foot deformities, the types of shoe we should wear. We looked at shoes. We actually took up the shoe. We looked at it. We spoke about poor circulation. We spoke about ulcers. And we did it in a form using language that our viewers can understand. And I hope they understood what we spoke about. We'll only know when they tell us. And I hope that it reached the population I really wanted to reach, because I'm seeing so many of our persons who have these problems with their feet and it gets really bad. And I believe sincerely that Dr. Nowell, I'm going to invite you to Jamaica as a podiatrist and to do some consults here. We don't have a lot of podiatrists on the island, and we have people who have a need. And we'll talk about that. You should pop across for a weekend and or a week or so and look at some of our patients that we have because its simplest advice makes the world of a difference in
Yeah.
people's lives. It is so simple. And we started off with the foot and the shoe, just that shoe that you wear, the flexibility of the shoe, the thickness of the shoe, so you don't get stuck by that nail. And then you get stuck by the nail, you put kerosene in it, which you shouldn't do. Then you end up with the bad toe, the bad foot, and you lose the whole foot. Some people lose their lives because of getting stuck by a nail. And that is why we started there. So I hope that this series on diabetic foot really, really, really gets to the persons it needs to get to. And I thank you so much. And stay tuned for our next conversation, which will be on the ugly toe.
The ugly toe.
That's what they call it. They call it the ugly toe, right? Yeah.
Same thing here. Same thing all over the world.
Yeah, they call it the ugly toe. And
Thank
we're
you.
gonna fix that. We're gonna fix that. We're gonna show them how to fix that,
Yes.
No problem. We're gonna talk about that. We're gonna fix that.
Right.
And yeah. All right.
Thank
Until
you.
next time.
And thank you for the invitation to Jamaica. I'll take you now.
Yes. Sunshine. Jamaica, no problem, man. Lots of white sand beaches. And music and coconut water. What else? And the patties. People like our Jamaican patties a lot, by the way. The diabetic can't really have too much of that, huh? Maybe a little piece. But I mentioned our patties. The brand, they know themselves. But that's that. All right. Bye.
Thank you.
Okay.